Well, thank you very much, Mr. Chair. And unfortunately, I have to go to a CCT event at 11 o'clock press conference. So I really appreciate the opportunity. Let me just start off by saying, first and foremost, kudos for developing the partnerships with Howard and also looking at USG. I recently toured their brand new building. Got a chance to see the facilities that are going to be there for those dental students and making sure that that relationship is there to further expand the potential for services, because as we toured that building, the first thing we thought is, how do we open this up to the community? So it's great to hear that you've already thought about that and you're thinking about that as a potential. I will tell you that part of the challenge is it'll be yet another service offered in Rockville. And when I think about what we're talking about in terms of our work, when we talk about transportation, when we talk about the challenges for folks in not having services where they live, it further exacerbates what already continues to exist. And that is the challenges that we face. Germantown has 100,000 residents, 40,000 more than the city of Rockville, and $200,000 less in an average home median price range. But we have 8 chairs in Rockville and 2 in Germantown. That's a problem. That's a significant problem. When we look at Silver Spring and how we're spread out in Silver Spring, but still don't have, so we need to beef up those areas. So our priority should be in taking and expanding those services into the areas that need them the most. And that is certainly there. When I look at Rockville certainly has pockets of poverty. There's no question about it. But certainly we need to take those services outside of there. And to that extent, I want to talk about the waits. I know I'm about to call my dentist now to get on their schedule for something. It'll probably be able to book about 2 or 3 weeks out. And this is a well visit. This is just a follow-up to a previous visit. To have a person, and we know people who are typically presenting at dentists have waited far too long, and those problems have gone far too long, and they're really at the emergency stage. And so to then present them with a 3-month wait is a tremendous challenge. So we need to be looking at this from an emergency triage perspective in terms of just getting folks in to evaluate for those emergency referrals. And so I hope that we're starting to develop that sort of thought process, similar to what we do with some of our medical clinics when it comes to, again, doing that initial triage so that we can get them on, and we can start to sort out, okay, your problem isn't that bad. We've got a cavity. I can do something very quickly, and then we can get you back in for another visit, something like that. So, Dr. Boyce, if you could talk about that.
We actually are working on developing a system of having, it's almost like a sick, I don't know if anybody's familiar with the military and how they have a sick call. Yep. And so having a doctor who is actually dedicated towards emergencies for every day. We get a lot of emergencies. Mm-hmm. And so at least we could address that emergent issue, and then they could be maybe sent out to either a clinic. They could get an appointment, follow-up appointment, either at Rockville or to one of our other clinics. Of course, Rockville is our biggest location, so the emergency doctor would be at Rockville. Now, mind you, all the clinics do have emergency slot appointments, but again, those are people calling in. We have a lot of walk-ins. We have patients sent from the schools on a minute's notice. Kids are adults are priority too, but if there's a child with an abscess, I'm getting them in that day. So that is a model we are actually looking at.
Excellent. That's really happy to. I'm really happy to hear that. I will just say that in terms of balance of services as well, there shouldn't be any of our dental clinics who don't do everything, if we're really talking about spreading the equitable model. And so from that perspective, I know all of this costs money. Right, and so don't get me wrong in the standpoint of saying, well, you're asking me for stuff that we don't have in our budget. But this Health and Human Services Committee has been very forthright with putting additional money into the budget to ensure that we can expand the level of services that are provided, and so that's our ask.
And I'll just comment on that. Part of that also comes from hiring I shouldn't say competent, but skilled staff. And so we are lacking in that area. We have doctors who are not feeling comfortable. Again, we have doctors who are worried about their liability. And so we're trying to remove those barriers so that doctors can perform all tasks in a public health setting. In a public health setting, there's a certain skill set you really should have, and so we probably need better screening of who we hire also.
Now, it's interesting because that's actually perfect timing. This is my last question, Mr. Chair, is around liability. I wanted to first start off with the conversation, Dr. Boyce, that you had about liability and without a parent being there. My daughters go to Liliana Cuervo in Montgomery Village, and my grandfather, their grandfather, my father, oftentimes takes them, not a parent. I mean, I'm sure that children 13, 12 years old aren't just showing up on the doorstep. So somebody's taking them there. They may not be the paternal parent, but certainly in those cases we fill out forms, and so having that information that's accessible, being able to reach the parent so that you can provide the services so that there's not an obstacle that's there. You're nodding, so I'm just going to assume that you're working on that and you're working through that.
Yes, we are.
Okay. The other part when it comes to liability, though, you know, we're a self-insured county. And so it's one in which I'm curious as to, within our overarching policy, why we wouldn't take on, if we're going to provide services, just as we do in some of our other things, in the broad sense of where it is, and just provide the liability coverage to free up so that our dentists and doctors can provide the services that are necessary for the community.
So this again goes back to reviewing the open solicitation under which the dentists are hired. They're contractors in which they have to provide their own liability. We are looking to see how we can make these dentist employees so that they are covered by our liability, and so that will not become a barrier.
I just want to weigh in, Councilmember Rice, that this is an issue that is not unique to the dental clinic in terms of how we do this work. We also have contract psychiatrists, and part of the terms of the contract is they are responsible for maintaining their licensure, but also maintaining their own malpractice coverage. And that carries with it some pluses and some minuses, obviously. And I think that's something we need to look at across the department where we have contract docs or professionals doing the work.